Hey guys, Martin from Reform. One of the most common questions that patients ask me, especially if they come in pain, is what should I use, ice or heat? So I wanted to shoot this little short video to walk you through ice versus heat, when to use ice, when to use heat, and I hope it guides you along your journey. Now, ice, your simple ice pack looks something like this. It's called a gel pack. It goes in the freezer. You apply it. Uh, Quite effective. And then heat pads look something like this. Come in different brands, but I'm going to talk to you a little bit about my favorite one today. So ice versus heat is the topic of today's video. But I will start off by saying ice in the last couple of years has a little bit of controversy. Some people don't think you should ice at all, but I still find it very useful in certain situations, and so I'm going to touch on that first. Now, ice is typically used for pain or inflammation, and I would agree that it definitely can help someone who is in pain. So I do recommend it for that. I do use it myself for that. We use it in the house for that when the kids hurt themselves as well. Ice a little bit different than heat. Ice, the application is short and intense. So usually a couple of minutes is fine. You have to be careful you don't freeze your skin, of course. But usually about 1.5 to 2 minutes tops. And then the goal is to let your body warm up to room temperature for about an hour, and then you can ice a second time as necessary. These are great. The gel packs are great, very convenient. You can keep them in the freezer at home, at work, etc. The actual best thing for icing that I have found, and I've actually read in the research, is you just fill a Ziploc bag with ice cubes and cold water, and you apply that to the area for that 1 and 2 minutes. So very cold, very short periods, let it warm up and repeat as necessary. Now, great for pain, great for inflammation. Now, these are more acute injuries, as you know. So typically with an acute injury, we're not recommending to put heat on it. But heat in the last couple of years in everything I've read is becoming the real winner. And that's why I love this one. This again, no affiliation with any brands, but this is the one I always ask people to get. Its brand name is Thermofor, and the nice thing about a plug-in electric heating pad is you plug it in and you read, you watch Netflix, whatever you do to unwind, because heat, unlike ice, you want to use it for about 40 minutes. Yeah, you heard right, 40. So that's quite a long time to be lying there on a heating pad, so you can keep yourself entertained. But for 40 minutes, the electrical pad will give you a nice constant heat. Now, that constant heat should be around a 3 or 4 out of 10. It should be quite low. Now, that heat can make the skin red, it can make you sweat a bit, but what I want you to think about is I want you to keep that heat low enough that you don't break into a sweat. If your skin is going red in the area, typically that's okay, because that's blood flow coming into the area. Follow the recommendations for any of the manufacturers on these heating pads, because you can burn yourself, so you want to be a little bit careful with that. If you understand that blood flow is good, things that are warm tend to move better, they're more pliable. That's why I find heat's the best recommendation for more chronic conditions. Now, chronic conditions can be anything over roughly 6 weeks. So the whole idea of ice for really acute injuries and heat for more chronic tends to be what does work. And so, I hope this helps you a little bit. It's a question I get a lot at the beginning from patients. Typically, heat seems to be the winner overall. And so the goal here is to help you on your journey to keep healthy, keep well, and keep mobile. So if you have any questions or comments, feel free to throw them below this video, and I'll try and do my best to answer them as soon as possible. Or feel free to send us a message and we can answer any questions you have online. All right, take care, guys.